afternoon. Greetings from all of us at Apollo Hospitals. Welcome to our Corporate Health Series. This is Dr. Srinidhi Chidambaram and I'm very happy to see you all again. I hope you all have been well and in the best of health and spirits. The first step in conquering any disease or health condition would be to understand it thoroughly. However, this is not always easy because medicine is a complex subject and there is any amount of misinformation out there today on social media that can confuse and mislead you. And of course, with your busy careers and work, you might not have the time to spend on learning about health issues. This is why we have been presenting these sessions regularly to help you know about various common diseases and conditions straight from our top specialists. Today is World Asthma Day, and you're all, I'm sure, very familiar with the term asthma. It is a chronic respiratory condition. That means it affects your lungs, and it might have acute exacerbations where your airways can get narrow and swollen and blocked by excess mucus. It is possible, however, to keep asthma in control, to reduce and prevent these acute attacks and the acute exacerbations as well. So World Asthma Day is held every May to raise awareness of asthma worldwide. The theme this year is actually Asthma Education Empowers. So it emphasizes the need to empower people with appropriate education and awareness to manage the disease, when to seek medical help, and actually the call is for healthcare organizations and professionals to increase people's awareness of asthma and to teach people how to take care, how to live with the disease, how to have a good quality of life, and make sure that people are equipped with reliable information and optimal treatment options. So today we are doing exactly that. And I do hope that our session will help in creating that much needed awareness about asthma, to explain all about this common health issue and guide you on how to live your best life with asthma. I am very happy to welcome Dr. Chandrakant Tarke, a distinguished pulmonologist and chest physician at Apollo Hospitals, Jubilee Hills, Hyderabad. With 11 years of exemplary experience, Dr. Tarke has earned widespread recognition for his outstanding contributions to the field of pulmonology and respiratory medicine. He holds an MD in pulmonary medicine from the Vallabhbhai Patel Chest Institute, Delhi, a DM in pulmonary medicine from the University of Delhi, and a European diploma holder in respiratory medicine from the University of Bern in Switzerland. Dr. Tarke also strengthened his experience by completing advanced interventional pulmonology training at the Serdang Hospital at Malaysia. As a leading specialist, he offers a comprehensive range of services catering to various pulmonary and respiratory conditions, and his diagnostic and therapeutic capabilities span advanced procedures like EBUS, bronchoscopy, and pleural interventions. His exceptional contributions have been widely recognized. He's a recipient of several prestigious awards like the NCCPI Professor S.N. Gaur Young Scientists Award for the Best Clinical Research Paper presentation. He's part of the Guinness World Record for participating in the largest oral hygiene lesion event at Telangana, recipient of the Dr. APJ Abdul Kalam Memorial Excellence Award, Vaidya Ratna Award by the Mother Foundation, the Apollo Young Clinician Award, Telangana Bhushan Puraskar for the Best Pulmonologist, and many more. Thank you so much, Doctor, for joining us today. We are indeed privileged to have you. So we will begin by asking you to explain to our audience in simple terms, what is bronchial asthma?
Good evening, one and all. Asthma is an airway disease in which a person will get the airway constriction. Means what are the normal size of airway should be there, it will not be there. And patient will get the narrowing of the airways. Because of that, there will be difficulty in taking air out and they will get the cough, breathing difficulty, wheezing sound, and chest tightness. Basically, this is asthma.
So, what is the cause of bronchial asthma?
Bronchial asthma, as such, in most of the cases, will be hereditary. If father or mother or grandmother, somebody has asthma, so their child also can get asthma. And most of the cases, it will be because of allergy. It's some sort of allergy, mostly some house dust mite or some pollens. But although this most common cause is genetic or allergic, we can get non-allergic asthma also, especially those persons who smokes or those who are exposed to some pollution or industrial pollution or vehicular pollution. They also can get the asthma.
So, what happens? What is the clinical course? How does one first discover that uh, he may have asthma? And then what happens? Is it like a ups and downs kind of condition? What triggers these asthma attacks that we people are familiar with?
Asthma, as I told, there will be narrowing in the airways. Means airway size gets narrowed. Whenever you are exposed to some triggers, the airway will get narrowed. Because of that, person will not be able to breathe fully. Air will not go completely outside, and person will start getting some cough, dry cough basically, or sometime he may produce more mucus. There will be wheezing sound because of narrowing of the airways. There will be some resistance for air to go outside. There will be wheezing sound will be there, and person will start getting breathlessness. So these are the symptoms of asthma, and the triggers for this are the mostly some seasonal changes, and some people can get triggered with some different chemicals, fumes, and also house dust mite. So these are the common triggers of the asthma.
So, are there any particular, though the triggers can be very varied, but what is it that an asthma patient should be very careful about as far as triggers go?
It triggers, especially asthma patient will symptoms get triggered by the dust, as I told. In dust, particularly house dust mites and various insects they are that at home. Especially some houses are infested with some cockroaches, even mosquitoes. When they die, there will be dust inside the house. So there will be very minute particles that can cause trigger of asthma. Even some perfumes, chemicals, some cleaners, especially in even school children, they carry some cleaners while they do some painting. Even some nail paint removals. These are the various chemicals that we use commonly at home. These chemicals also can trigger the asthma. Also, some perfumes also can trigger the asthma. And especially when there is a stormy environment, when the person can get exposed to all these dusty particles, dusty environment, then asthma symptoms can get exacerbated. And these are the common triggers. And also some patients, especially after the viral infections, so they can get the asthma trigger.
And what would be the earliest, I mean, like, what would be the common symptoms of asthma, and what are the warning signs that one must seek emergency medical help?
Usually, whenever asthma symptoms going to start, before that person usually will feel some chest tightness. Later on, when the chest tightness progresses, they will feel some breathlessness, and wheezing will start, and they will get the cough. If it lasts for longer, but they can get some sputum production, phlegm will come, and eventually the breathlessness can go for longer period, and their oxygen levels can drop. So these things can happen if you don't control the asthma at that point of time.
And what age does asthma actually start? Is it like a childhood disease, or can somebody develop asthma in an older age group?
Asthma can be seen at any age, but most common age group is childhood. Asthma usually starts with childhood or adolescent period, but now because of the change in the lifestyle and environmental pollution, and even various viral infection, this COVID pandemic, the asthma we are seeing even in the adults or in elder people, the asthma is common nowadays, and even obesity, some persons with some acidity, gastroesophageal reflux, and sleep apnea, sleep disorders. In such patient, they can develop the asthma even after the age of 50 also. But most common starting age of asthma is a childhood, but any age is not a exclusion. People of any age group can develop the asthma.
So, how do you really tell the difference between other respiratory conditions, or even sometimes, and there is a little bit of upper respiratory infection with the starts off as a cold and then progresses to the cough. So, how do you differentiate between bronchial asthma and other conditions which might also cause some cough and tightness in the chest and phlegm and things like that?
Mhm. Asthma is a lifelong disease usually, and there will be many ups and downs. Means patient can have symptoms again, symptoms will go, and when the environmental changes, some trigger exposure happens, the symptoms they can develop. That this is a variable airborne obstruction will be there, and symptoms usually common symptoms of the cough, wheezing, and shortness of breath and chest tightness. But usually in the viral infection, you will get the cold and fever, some throat discomfort, headache, body pains. These are the symptoms with the viral infections. So some symptoms are common, such as cold we can get in asthma also, because some patients with asthma, they are allergic. They can get some allergic rhinitis. They can get sneezing bouts. They can get the running nose. That is called the allergic rhinitis. That is the allergy of the upper airway. And allergy of lower airway is asthma. So it's difficult to differentiate, but with the symptoms such as fever, throat discomfort, or some body pains, we can say it's related to more likely infection or upper respiratory infection. But symptoms are more like sneezing bouts or exposure to dust, some wheezing, chest tightness, breathing difficulty, and we can say more pointing towards asthma.
Right. Is it also precipitated by stress? So, since our audience is largely a working corporate audience, we know that they are exposed to fairly stressful lives. So, uh, is it at all related to stress, and can that precipitate an asthma attack?
Yes, definitely. Because asthma is a psychosomatic disease, not only allergens, even if there is no exposure of allergens, but if body is exposed to any kind of stress, either physical stress or psychological stress, there will be a release of certain chemicals into our body that will release to the some cascade into our cellular level, and these chemicals or the release, what are the chemicals released, that can lead to the bronchoconstriction, means narrowing of the airways. Similarly, that happens in the asthma. That's the reason this stress is considered as an important risk factor for the asthma, an important trigger for the asthma.
Right. So, you were saying that asthma is a chronic, lifelong condition. So, uh, many people will be continuing their daily lives along with an asthma diagnosis. So, what would your recommendations be on how they would be able to integrate managing their disease and having a productive and good quality of life?
Although asthma is a lifelong disease, but as such, we can control our asthma symptoms well, and even miss any. Usually, one more thing, always asthma is a lifelong disease, but some children, especially children, if they get the disease in the childhood, 50% of the children, we consider they grow out of asthma. And if 50% of the children, even during adulthood, symptom may persist. And some people, the asthma can start in adulthood and it may remain for lifelong. But it not necessarily the person will get the symptom at every day. If person changes the place or if they do some lifestyle modification, the symptoms can remain under control without any need of any medicine. But still, if the person is having the symptoms, so with the medications, it can be controlled well with proper use of the inhalers as per the doctor's advice, and also environmental modifications such as stopping smoking, avoiding the environmental pollution, and lifestyle modifications, stress management, breathing exercises. This can help to control the asthma well.
So, how is asthma diagnosed?
Asthma diagnosed basically on the symptoms of breathlessness, wheezing, chest tightness, and supporting test will be the pulmonary function test. Pulmonary function test, patient has to blow into one machine, and in that we'll see the lung capacity before and after giving the inhaler. During that test, one inhaler also will be given, and post giving the inhaler, if the lung capacity is improving significantly, that means your airways are narrowed before the test, and after giving inhaler, it is opening. That is the confirmatory test for the asthma. But it not necessarily every time it will come positive. But majority of the cases, diagnosis of the asthma depends upon the history, physical examination, and based on the symptoms.
So, what are the latest treatments, or what? I mean, let us begin by talking about what is the way in which bronchial asthma is treated and what are the latest innovations in this field.
Most important treatment of asthma is the inhaled medications. In inhaled medications also there are two types of medication. One is the inhaled bronchodilator, or other is the inhaled steroid. If you utter the word steroid, many people will get afraid that doctor is giving the steroid like that. But if you see, these steroids are in the very low dose, in the micrograms, and that acts in the airways. When a person takes the inhaler, very less quantity will go to the airways, and from that also very less quantity will go to the blood. As such, side effect of the inhaled steroids are not there. No major side effects. And even if you take it for the lifelong. So these are the inhaled steroids, and inhaled bronchodilators such as salbutamol. It will open the airways immediately. But nowadays, the main treatment is a combination inhaler. So for example, salbutamol inhaled steroid. So usually these inhalers come in the color code of some brown or red. The blue inhalers previously used to have the river inhalers. Nowadays, these are not recommended. Even in the routine mild asthma also, we need to advise red or brown colored inhalers. And these are called as a reliever and control therapy. This is the first and most important therapy. Other therapies for asthma are some anti-allergic medications with a combination of montelukast, levocetirizine. And in addition to that, there are some immunotherapies to control the allergy. These are also available. And nowadays, some newer therapies also have come, such as a bronchial thermoplasty. In that, this is a special form of treatment to control the asthma.
So, what is that, doctor? What is bronchial thermoplasty?
Bronchial thermoplasty basically is a bronchoscopy technique. Means we need to insert some small pipe with the camera inside the airways. There will be one probe on, there will be tip. That probe will generate some heat, and because of that, the muscles which are narrowed, there will be the hypertrophy of that muscle, the airway narrowing will be there. That will burn off that area. That airway will, narrowing will get released. This will be helpful for those patients with chronic asthma who are not responding to the inhalers, who are not responding to the routine medications of the asthma, and who are requiring the continuously some oral steroids to control the symptoms. In this patient, this bronchial thermoplasty will be helpful.
Right. There is also a situation where we know that an uncontrolled asthma attack can cause an emergency. So, what can you explain a little bit about that, and when people need to go into the hospital for treatment?
Normally, whenever the patient of asthma is diagnosed, we tell them to use the inhaler. And normally, we should give some asthma plan to the patient. Means how to reduce the dose, how to use it. For example, if the person is having symptom during some particular season, we asked them to use during particular season. If person gets once in a month, twice in a month, SOS, we give that inhaler whenever required. But if the person is getting symptom every alternate day, 2 to 3 times in a week, usually in such cases, we advise the use of inhaler daily. And so they should stick to their proper treatment. And instead of using treatment correctly, an inhaler technique is also more important. Many patients, they don't take the inhaler as advised, that medicines will not go properly inside the lungs. Because of that, also asthma can get uncontrolled. There are other factors also, such as some patient can have allergic rhinitis or some acidity, gastric reflux. So we should tackle these things also to control the asthma well. And in spite of this, asthma is not under control. That's what is uncontrolled asthma. The person should visit to nearest emergency. In such cases, usually doctor suggests to use an nebulization, and they will give some injectable, some steroids also. And with that, most of the patient asthma can get under control. But there are some newer medications also nowadays. For severe asthma, antibodies are available. These are called as some various medicines are there. These are called as monoclonal antibodies, such as mepolizumab, omalizumab, benralizumab. These are the injections that we give every monthly for 6 months or 1 year. These injections are a little costly, but we can control the asthma well. And need of the oral steroids or inhaled steroid dose can reduce with the use of this therapy, and the asthma can get under control.
Another question which corporate employees may be having is that when they are in the necessity to travel to different places, what are the precautions that they may have to take if they are already prone for asthma?
Yes, travel is the most important aspect in asthma patients, because whenever they travel, they will get exposed to the different environment, different pollens in that area, different trees will be there, different pollens will be there, and that can trigger their asthma. Even the seasonal change means once they go to cold climate, the asthma symptoms can get triggered. And they should take the precaution. They should carry their inhaler with them, and they should use as advised by the doctor. Even nowadays, as advanced treatment, we are having the inhalers which can be used once daily also, because with some busy schedule or sometimes they forget to take the inhaler. So some inhalers are there which acts for the 24 hours. So this is the newer advancement in the asthma. So with such kind of inhalers can be prescribed to such corporate people, and with that they can control their asthma well.
Right. Also, are there any lifestyle modifications that people can do to control their asthma? As in, are there any breathing exercises, or does exercise or a particular diet help?
Yes, lifestyle modifications, we need to take precautions, such as we should not get exposed to dust, smoke. Smoke may be either first-hand smoke or second-hand smoke. That can also, even the person is smoking beside you also can harm you. That can trigger the asthma. And indoor air pollution is also important factor. Even normal, that agarbatti or dhupbatti can produce a large smoke. That can also trigger asthma and even can cause COPD. And the home should be insect free. We should do the regular pest control, and we should avoid the strong perfumes or some chemical fumes at home that can trigger the asthma. And in breathing wise, yoga, pranayama, this exercise helps. One technique is there that is called the diaphragmatic breathing. In this, we keep one hand over our tummies where we feel our diaphragm, one hand over the chest. Then we breathe through our nose, and we'll feel that our hand, which is over the tummy, that is moving outside. Okay. So we basically need to feel that diaphragm is moving in and out with our every breath. One should do this breathing 5 to 10 times for 5 to 10 minutes, once or twice daily. It's called the diaphragmatic breathing. With that, also many patients with asthma can get controlled.
Right. Is there anything else that you would like to advise our audience regarding asthma?
Asthma is a lifelong disease, but we should not worry for that, because almost 10% of the population in India have the asthma. And if you see, many sports persons are there, even in India and even abroad, even in the Olympics also. Just to give an example, Mr. David Beckham is there, is a famous player. He also revealed, he told he has asthma. But all these persons can control their asthma well with the use of the inhalers and the medications, and they can lead to the normal life. They can live what are the normal expectancies of that life they can live, and even they can do all the activities. If they use the inhaler, they can do any amount of exercises as of their colleagues. So it should not be a hindrance for anything. Means whatever their lifestyle is there, whatever their work is there, job is there, everything they can do. Only thing they have to take some precautions and they have to use the inhalers as per the doctor's advice.
Thank you so much, Doctor, for your wonderful advice and guidance on bronchial asthma. So, viewers, I hope you had a useful session on bronchial asthma. So, please remember that when asthma is not diagnosed and when it is not treated, it can cause a lot of disturbances. It can affect your daily life. It can cause poor concentration, poor productivity, and it can have also serious effects. If you have uncontrolled asthma attacks, you may need to receive emergency healthcare, may need hospital treatment and monitoring. So it's important to be aware about asthma, to understand that it is completely manageable. You can have a good quality and productive life if you manage your asthma well, and make sure that you take your medicines, your inhalers. You do not lose track of your asthma control, and then you don't need to worry at all. So thank you so much, and please do reach out to us through any of our digital and social media channels for assistance. See you all soon. Thank you and namaste.